This is a narrated presentation. You should run this presentation as a full-screen slideshow from the beginning. Once started, it should progress to the final slide with the narration sequenced through the slides. Welcome to the NIMIS eChart ordering training session. NIMIS is the National Integrated Medical Imaging System. NIMIS is tailored to the requirements of the specific hospital. In Mayo, we use the eChart module to access the radiology information system. We use it to request examinations, view the status of examinations, and read reports. In this session, you will be shown how to use the eChart ordering module for Mayo University Hospital. You will also be shown how to log into NIMIS PACS. When you have completed this presentation, please contact the PACS office to obtain your login details and password. If you are not attending the training session in the radiology department but viewing this presentation remotely, you can obtain the pocket guides referred to hereafter from the PACS office. There are over 40 medical facilities live on NIMIS. Each NIMIS site can access imaging from every other NIMIS site. A full list of NIMIS facilities is available in each ward area. In the Salta Hospital group, the other NIMIS facilities are Sligo, Portiuncula and Letterkenny. Significant facilities for Mayo referrals would include Beaumont, The Mater, Crumlin, Kappa, the National Rehabilitation Hospital Dunleary, Tala and St James's Hospitals. Please note University Hospital Galway is not on NIMIS, however we do have a digital link for transferring images to the UHG quarantine packs. If you receive a disc with images from a non-NIMIS site, you must bring the disc to the PACS office to be uploaded. In NIMIS there are two core packages you need to become familiar with. NIMIS RIS, the PC icon for this is on the left, and NIMIS PACS, the icon is on the right. The RIS icon must be the rainbow icon with the words NIMIS RIS 2022. Do not use the old version without this text. The hospital PC should be logged on with the ward account. When you find the appropriate icon and launch the RIS or PACS, you will need to enter your NIMIS username and password. This is the RIS login screen. The login boxes are in the top right hand corner. This is the PACS login screen. You have the same username for RIS and PACS. Their passwords are not connected, but you can synchronize them by resetting them at the same time. Where available, you should use a NIMIS workstation. You will use your NIMIS username and password and then have direct access to the full software. NIMIS is a national system. All HSE staff are obliged under the Data Protection Act to safeguard patient information. When you log into RIS, the front screen displays this message. It reminds you of your obligation under the Data Protection Act to safeguard patient information. Please take a few minutes to read this message when you first log in. If there is a breach in patient confidentiality, the PACS office can generate an event report to see who has accessed the patient's record. You should not access or discuss patient confidential information inappropriately. You should also safeguard your access to this information by not giving other people your login information. You should also not leave a computer without logging out of the system. We will now go through the process for placing an order through eChart. The learning objectives are understanding the difference between the patient accounts on the Integrated Patient Management System, or IPMS, entering the patient identifier in the search page, selecting the correct patient and account, filling in the appropriate information, selecting the appropriate examination, additional information to be supplied, prompt responses, do's and don'ts. Every time a patient attends the hospital, there is an episode of care created on the Integrated Patient Management System, IPMS or IPIMS. This episode of care or account reflects the patient's location be that an ED attendance, an inpatient admission, or an outpatient attendance. This account also reflects the consultant team that the patient is under. Note that the patient may have several episodes of care or available accounts at the same time. They may have been admitted under the surgeons as an inpatient, but also have a recent active outpatient account under the medics. The account in use today should be the inpatient account. Another example is a patient attending the emergency department after a fall, but is due to be seen by the urologist next month in the outpatient department. You need to select the account which reflects the appropriate episode of care for the patient. You should not select an outpatient account for an inpatient or an inpatient account for an outpatient. When you have selected the correct account, it should reflect the location of the patient at the time of the examination and the consultant to whom the results will be sent. Please note this carefully. When a patient is admitted to a ward from the ED department, the ED account is discharged. Any outstanding requests will not move to the new account, so you must edit the request. You select the correct account and ensure your consultant's name is entered in the attending consultant slot. If your patient is due for admission from the ED department and you want to request an examination that will probably be performed after they have left the ED and gone to the ward, you would be better to wait for the inpatient account to be created before requesting the examination. This slide will be repeated later. Launch RIS on the hospital PC or the NIMIS workstation. Click on the eChart icon. We usually search using the patient's medical record number. You can use the name search by entering the surname, then a comma and a space, and the first name. Please see the pocket guide. Having launched eChart, you will be presented with the search screen. Enter the patient's medical record number in the box in the top left-hand corner. If you are entering the name, type in the surname, comma, space, first name. If using a name search, you should try to narrow your search by entering the date of birth in this format. If your search returns more than one result, select the appropriate patient from your facility. The other patients on the list are attending other institutions within the NIMIS family. In this example, the other patient's name has been removed to protect their identity. You can select your patient by double-clicking on their name or clicking on the Open button at the bottom right-hand corner of the screen. When you have opened your patient's RIS record, you can view the examination history and the status of their examinations. They will be ordered, arrived, filmed, stopped, signed or cancelled. The red buttons at the bottom of the screen allow you to view an order, add a new order, edit or cancel an order, and when the image and report buttons are not greyed out, you can use those to display the images or the report. If the study has an S beside it, it has been scheduled to be performed at a date and time shown in the schedule box on the right hand side of the screen. If the study has been cancelled, you can hover your mouse cursor over the study to see who cancelled the study and why it was cancelled. You can also use this hover tool to look at vetting notes to see who has vetted an examination and read any comments they have made. This may provide you with details of further clarification needed to proceed with your examinations. If the status is arrived, this means that the radiographer is ready to perform the examination. If you need to change the order for any reason from this stage forwards, you need to contact the radiographers immediately. When the status changes to filmed, the study has been performed by the radiographer and is ready for the radiologist to read. At this stage, the image button at the bottom of the screen will be enabled, allowing you to view the images from within RIS. When a study has signed status, the radiologist report is available. The report button will be enabled and you can use it to view the report. When the status reads stopped, this means your image management request has been completed and your images have been transferred, or the disc with the images on it is ready for collection. To add an order, click on the red Add Order button at the bottom of the page. You will then be presented with the active accounts for your patient. For demonstration purposes, this slide was created using an active ED account on the 20th of December 2017. The patient details have been removed. You need to select the appropriate account, in this case the ED attendance on the 20th of December 2017. Notice that it is not the top one on the list because the patient has a future outpatient appointment with Dr. Bartels on the 21st of the 5th 2018. If you look further down the list, you can see that the patient has an open surgical outpatient account under Mr. Waldron. There are also GP accounts there. You will never be using a GP account. Now go back up and look at the ED account that we are going to use, and notice that the ED accounts do not have attending consultants' names entered into them. Please remember when presented with the Select Account page that the default account will not always be today's account, so you should actively select the account on every occasion. Do this by highlighting the correct account, then click the Select button, which is in the bottom right hand corner of the page. If your team is called to consult on an inpatient in the care of another team, select the admitting account and use the Copy To field to enter your consultant's name. In this example, you are working on Prof. Barry's team and have been asked to see a patient admitted under Mr. Lang. Select the admitting account and enter Prof. Barry's details in the Copy To box. This way both the admitting consultant Mr. Lang and your consultant Prof. Barry will get the report. Having selected the account, you will be brought to the Order Details page. The yellow boxes are compulsory and must be filled in appropriately. Note that your name should be in the Entered By box at the top of the page and the yellow Requested By box on the left. The yellow Order From box at the top of the screen under your name will have the correct location if you have selected the correct account. If it is not the correct location for the patient, hit the Select Account button and select the correct account. Simply changing the information in the Order From box does not change the selected account. In the Contact Number box, give details of how you can be contacted to discuss the case. Your bleep number is preferred. As mentioned before, the Attending Consultant box will not populate for ED attendances. Click in the yellow box and enter the consultant's details, surname, comma, space, first name, and select from the list presented. For inpatients and outpatients accounts, the patient's attending consultant will automatically be filled in for you. If you have been called to discuss a patient from another team and want your consultant to receive the report, you select the appropriate account for the patient and enter your consultant's name in the Copy To field. Below these boxes is an ambulatory status field. Be as accurate as possible here. We will attempt to bring the patient to radiology department by the method you select. It may delay your examination if you select the incorrect ambulatory status. In the Clinical Indications section, enter only the relevant, concise information which justifies your requested examination. Avoid using niceties such as please or thank you, and do not restate the exam you require. You will be entering the exam details later. For example, poor air entry, bilateral creps, decreasing O2 sats. These are all relevant details for justifying a chest X-ray. Please perform a chest X-ray on this elderly patient, thank you, is useless and does not justify the examination. Give relevant, concise, clinical details, please. Do not hit return to put separate points on separate lines, otherwise the next person has to continuously page down to read what you have entered and may miss the important details on later lines. Please remember the radiologist's report will go to the named consultant in the Attending Consultant field. If you are asked to consult on a patient from a different team, please ensure that your consultant's name is in the Copy To field to ensure that they receive the report also. Now that all the yellow boxes are filled in appropriately, you can press the Add Exam button at the bottom left-hand side of the screen. Having pressed the Add Exam button, the Exam Master page opens. In the top left-hand corner, leave the selection set to Description. You enter the exam description in the box on the top right-hand corner. The exam description is led by the modality code CT, XR, US, and so on. This pocket guide has all the codes. For example, XR gives all the X-ray exams. CT gives all the CT exams. If you are more specific, the search list will be more specific also. XR space CH will give you exam descriptions of X-rays which begin with CH. CT space B gives all the CT exams beginning with B. If you cannot remember the exam description, you can search for specific words by using a string search. Enter %sign space word. For example, % space abdomen shows all the exams including the word abdomen. The same applies for % space soft tissue or % space spine. Once you have found your exam, double-click on it to move it to the Selected Exams section in the lower part of the screen. If you want to remove an exam from the lower section, double-click on it and it will be removed. You may select numerous exams from within the same modality code as shown here. Ensure you have the clinical details justifying all the selected examinations. Do not place exams from different modality codes in the same order. This is called a cross-modality order and will be cancelled. For example, you cannot put an X-ray chest with a CT brain. These are two separate orders. When you are happy with your selection, click on the Save button in the bottom right-hand corner of the screen. This will bring you back to the order page. For this example, I selected an ENT outpatient account under Mr. Lang. You should check all the details are correct before proceeding. My name is in the Entry By and Requested By boxes. The correct patient location is in the Order From box. I have my contact number entered. Mr. Lang's name is in the Attending Consultant box. I have the correct ambulatory status and have concise, relevant clinical details for the exam I have selected. I am now ready to save this order. To do this, I click on the Save button. You have now been brought to the prompt question page. These questions are tailored to the hospital requirements and are designed to ensure that you have the correct details to enable your exam to proceed. There will be additional information questions and safety questions tailored to the patient and examination you have requested. These questions are designed to make you think about further information related to the examination which will be necessary for it to proceed, or may reveal that your patient is not suitable for the examination. For instance, in the MRI questions, you will be asked if the patient has a pacemaker in situ. We cannot do MRI scans on these patients in Mayo University Hospital. The first two questions are applicable to every examination. First, have you selected the correct account? This is self-explanatory. Second, does the patient have any allergies or asthma, and are infection control precautions required? You must specify the risk in the Notes section on the previous page, e.g. query MRSA, query C. diff, query TB, query HIV. Please click Cancel to go back and enter the details. If precautions are not required, enter No. When you press Cancel, it does not cancel your order, it just brings you back to the previous page to allow you to enter the required information. These are important patient care details and should not be disregarded. Once you have entered the details, you can press the Save button to return to the prompt page and proceed. The third and subsequent questions depend on the patient and exam requested. For example, you must discuss all MRI and CT requests with your consultant prior to placing the order. If you are required to enter details in the prompt response boxes, do not skip this step by entering a space or a full stop. For example, if you are required to give a current creatinine result, enter the data or give information letting us know that the results are pending. When you have answered all the questions appropriately, click on the Save button and your order has been placed. There are some additional areas of the order page you need to be aware of. Looking at the top right hand corner, never change the date. Below this is the priority selection box. This is never used in Mayo University Hospital. This section is used in some facilities to arrange urgent examinations and prioritise the reporting of the same. In Mayo, for urgent examinations, you need to contact the modality team or the radiologist to discuss prioritising your examination. Out of hours, you may need to contact the on-call staff to arrange your exam. Never assume that changing the priority to urgent means that we know you have an urgent request in place. This may in fact delay your exam because we do not have any staff who are monitoring priority studies. This is the data protection notice which displays when you log into RIS. The note at the bottom states that system audits can be run. These audits and event reports can be run at any time to see the activity on a patient's records. They can also be set to run automatically. There is a tick box beside the words Consent for Disclosure. There is an assumed consent for patients who attend the hospital, so this box is by default ticked. This means they consent to appropriate use of their data by HSE staff. If this box is unchecked, event reports are generated recording all access to the patient's records, both RIS and PACS. You may need to uncheck this box for specific patients, for example, staff members, children under protection orders, public figures, and so on. This just gives us an extra layer of attention and reminds us to respect the patient's data security and privacy. Anyone trying to access restricted images in PACS will be informed that they do not have the authority to open the images. You may still access the images by pressing the override button if there is a clinical reason for you to do so. Note all access is logged. In the next section, the learning objectives are understanding patients for discharge and outstanding requests, selecting the appropriate examinations, spinal precautions, special examinations, image management studies such as transfer to UHG and copy disks, uploading of external images, the PACS system layout, some final notes, and logging into the system and setting your password. This is a special note for the medical teams who work in the Sacred Heart Home. You may use electronic requests for St John's step-down unit. They are considered as inpatients in Mayo University Hospital. All other Sacred Heart Home referrals must be on paper. When you discharge an inpatient, you are also discharging any inpatient requests left on the system. It is your responsibility to check for outstanding examinations and deal with them. Often these examinations can be scheduled in the next few days under the current episode of care. If an inpatient is being discharged and is to be followed up with an outpatient appointment, you may request an examination to be performed prior to that appointment by selecting the future outpatient account. Get the outpatient account created by the ward clerical staff or contact 3525 to arrange this. An example of this is where a patient is being discharged with antibiotic treatment for a chest infection and your consultant requires an interval follow-up chest x-ray in 3 weeks prior to the outpatient appointment in 6 weeks. If an inpatient is being discharged and is not to attend the outpatient department, but you require an examination to be performed in the future which will be followed up at another institution, you need to get a POP account set up. This is a pre-outpatient account and will not have an associated consultant assigned to it, much like the ED account, so you will enter your consultant's name in the attending field. If the ward clerical staff cannot set up a POP account for you, please contact the radiology department on extension 1332 between 9 and 5. Out of hours, you can contact the ED reception on 2380. An example of this situation is a patient who is being referred to the urology team in UHG and will not be returning to an outpatient appointment in MUH. However, the urology team requires an ultrasound scan of the kidneys in 2 weeks prior to seeing the patient in 3 weeks. If you would like to discharge an ED patient and you are waiting for CT or ultrasound examination which cannot be performed today, discuss this with the CT or ultrasound staff to schedule the examination for a later date. For example, tomorrow at 11:30. Your patient will come directly to radiology for their ultrasound kidneys or CT-KUB. You may now discharge your patient and they will have their examination under this episode of care or this account. Leave any further follow-up examinations to the GP or request them under an outpatient account. If you have not made arrangements for the scan and discharged the patient, then your examination will be cancelled. Please note this carefully. When a patient is admitted to a ward from the ED department, the ED account is discharged. Any outstanding requests will not move to the new account, so you must edit the request. You select the correct account and ensure your consultant's name is entered in the attending consultant slot. If your patient is due for admission from the ED department and you want to request an examination that will probably be performed after they have left the ED and gone to the ward, you would be better to wait for the inpatient account to be created before requesting the examination. See the pocket guide for help with these discharge situations. Please try to select the appropriate examinations. For CT, the rule of thumb is scans below the neck are with contrast, above the neck are without. Most spinal studies are without contrast, for example trauma studies. There may be circumstances where this does not apply. Please discuss this with your radiologist or your consultant. If your patient is known to be allergic to contrast agent, ask the advice of the CT radiologist. All CT and MRI scans must be discussed with your consultant prior to placing the request. For CT examinations where you are asked to fill in the creatinine results, fill them in the order displayed. Creatinine result, space, date of exam, space, weight of patient in kilograms. You do not need to insert the units for the creatinine, but please add kg after the weight of the patient. The weight is required for calculation of the creatinine clearance. Not supplying this information may delay the test. You can put awaiting results of tests done this morning, for example. External examinations such as MRI external spine are studies which have been uploaded from other non-NIMIS facilities. We do not upload images which were performed in other NIMIS sites, as these are already available on the NIMIS system. You will use the external examination description to request the upload of images from discs which patients bring to you or which you have acquired from other non-NIMIS institutions, for example UHG, the Galway Clinic or the Bonds. See the pocket guide. Please note, as per radiologist instructions, no external examinations will be uploaded without a report. Special note on 3-foot spines. This is a standing X-ray of the whole spine for kyphoscoliosis and is a specialist request. This study is usually only done on a booked basis, however the radiographers will accommodate where possible. Contact 3066 and discuss before sending the patient to X-ray. To request multispinal regions, for example in the trauma spine, select XR space spine and choose each region as required. You may also do this with CT space spine. Trauma spines must be performed on a spinal board. However, if you accept the clinical responsibility to allow the exam to be performed without the spinal board, e.g. the patient walks in having had an injury several weeks ago, and shows no signs of a clinical risk, then you can state in the clinical indications that spinal precautions are not required. It must be in the yellow box. There are two leg measurement examinations available. Leg length is a CT scanogram, and leg angulation is a specialist examination preferred by Mr. O'Grady. Please discuss these examinations before requesting them. The combination exam chest and abdomen X-ray, including chest and abdomen portable, is exclusively for pediatrics, where the chest and abdomen will be displayed in one image. For guidance, if the child's torso is the size of an A3 sheet of paper, then this is an acceptable exam.
Use the IM group for image transfers. IM beam image record transfer, IM CD burn, IM GUH image transfer. In the clinical indications section, please do not enter the patient's clinical information on these requests. Just list the examinations to be copied and dates performed. Identify the other hospital and the clinical team. Urgent cases must be discussed with the PACS office. Phone 1333 or drop in. When we start to process your request, the examination is displayed as stopped. Image management requests are dealt with several times a day. If your request is not urgent, you do not need to contact the PACS office.
If you are referring a patient to Galway Group of Hospitals and need their images sent, we can transfer them electronically to the quarantine packs in UHG, where the teams can view them using Xero. These images will drop off the quarantine in time, but the team in Galway can request to have them imported to the main packs by placing an order on MediWeb. If there has been a recent request to transfer images, look at the clinical indications for that exam to see if your studies have already been sent. When the studies are sent, the exam status is displayed as stopped.
To request image copies on disk, use IM CD burn. This should only be used for onward clinical referral to a non-NIMIS institution. Ensure you are not requesting a disk for transfer to another NIMIS hospital. If the patient is returning home from abroad, include this information on the request. Where there is no onward clinical referral or the patient is not going for a second opinion, the patient may request a copy for themselves through the Freedom of Information Office. If you need a disc produced for an outpatient to collect today, inform the PACS office so we can begin the burn process. It may take up to 30 minutes to produce a disc after we are informed. In all circumstances, inform us how the disc is to be collected, e.g. the patient will collect when leaving the hospital, or give the disc to the patient when today's examination is complete. The team will collect the disc tomorrow. BEAM is a secure system for transferring studies to and from the radiology system in non-NIMIS facilities such as the Galway Clinic and St Vincent's University Hospital. For outgoing transfers, we need the name of the receiving clinician and hospital. We frequently request images to be sent to us from University Hospital Galway and the Galway Clinic. You need to confirm the date and location of the source study. The workflow for BEAM is evolving. All requests must be discussed. Phone 1333 or call in to the PACS office.
As mentioned earlier, you can view images for an individual study through the Image button in RIS. However, if you are image-centric or viewing multiple studies, you should log into PACS.
Remember, there are two different systems, RIS and PACS. Avoid opening PACS from RIS if you want to view more than one patient's images. Use the NIMIS workstations where they're available. Do not share your login details, and remember to log out when you leave a workstation. If you need to search for the studies you have requested, go to eChart and search by physician in the middle of the page. Enter your surname, comma, space, first name, and then press search. Now change the date on the top right hand side. All the studies you have requested on that specific date are now displayed. The names have been removed for this presentation.
When you have completed this presentation, please come to the PACS office for your login details. You must bring these access control forms with you, filled and signed. They can be obtained from the Medical Manpower office or the PACS office. Let the PACS staff know if you are on call tonight. We will get you to log in and ensure that you have access. Good luck, and do not hesitate to contact the RIS or PACS office for any advice you need. My name is Paddy Mallon, PACS Manager, and my extension is 1333. Your RIS Manager is Ailish Mangan on 1332.